A very, very good evening to you, viewers. Wow, I trust that your Sunday has been great. I trust that you've had a very, very good weekend. The fact that we are alive, we have to be grateful. We have to thank God. So, tonight, well, let me introduce myself again. My name is Floris Lyman. As you can know, this is Practical Talk with Floris Lyman. I love to bring you events and topics that is pertaining to us to welfare. This platform is to talk about things regarding welfare, and well-being, finance, faith, everything that has to do with us as humans as best as I can. So I'm just going to give us all 1 minute for us, or a few seconds for us to share this, because what we are talking about tonight is very important. Hosea 4:6 says, my people suffer. My people are suffering because of lack of knowledge. We need to be aware of what is going on around us. We need to be aware. We just need to be informed so that when things are happening, we are not surprised and we are not running all over the place. We are not panicking, right? So I'm just giving us a few minutes for us to share this so that many others will be able to join us, right? Thank you so very much. I will be with you in a few seconds. Thank you. Thank you all. All right. Thank you again. Once again, viewers, thank you so, so much for joining us today. Today, I have my guest with me. I've just been thinking, I was thinking, so, I need to talk about something that is prevalent in our communities. I think it's so important, again, like I have said earlier on, for us to be aware. I think I am a little bit earlier in talking about this topic because I know the month of October, the whole of the month of October is actually going to be on breast cancer awareness. But, it's never late and it's never too early. It's very important for us to ensure that as women, and there have been a few men where we're going to know today from our specialists. It's very important for us to check ourselves. This is a health challenge that is faced by so many people amongst us in our communities around us, and we just need to be so well informed about it so that we can prepare ourselves when, if anything happens. So today I have my special guest who happens to have been my senior in university. So, I've known her for many years. She was my senior in university. I don't take relationships and I don't take people for granted. I really respect her in her field of profession. Madam Tina Davis, OBE. So you're gonna know the reason for the OBE. Madam Tina Davis, she is a breast cancer nurse specialist. She is also a fertility clinical nurse specialist. So when it comes for us to talk about fertility and things like that, for many of you women, and men trusting God for the fruit of the womb, that's again another area that we can really look into. Um, She was awarded the Most Excellent Order of the British Empire. So that's the OBE in the New Year's Honors List 2016 of the Queen Elizabeth II for her services to the Ebola response in Sierra Leone as head of psychosocial pillar at the National Ebola Response Center in Freetown. So if many of you can remember, there was a challenging time in the lives of Sierra Leoneans where we had the Ebola, and it really did hit us badly. So for the great work that Madam Tina and her team, for the great work that they did, she was given that award by the Queen. Now, she's also received a gold medal for her service as head of child protection and psychosocial during one of our presidents in Sierra Leone, again, amongst the Ebola Honors Award ceremony. That was in 2015. She had made so much contribution to gender as the only female national pillar lead in the Ebola virus disease response since 2014. Madam Davis has successfully coordinated all activities in the districts covering affected communities, orphans, and survivors. She highlighted the role of women in getting to resilience zero of Ebola transmission and maintained the data of all affected children, including orphans and survivors. She's also an advocate for survivors, highlighting the health and psychosocial challenges survivors are facing, especially the female survivors who had afforded burden to care for orphans. She has also made scientific contributions. She's one of the co-authors for research on NPA persistence in the Semen EVD survivors 2015. She's also one of the co-authors for research on NPA persistent in semen and survivors in 2017, published by the New England Journal of Medicine. She's also one of the co-authors. She's loaded. So just bear with me. We have to give honor to whom honor is due. She's also one of the co-authors for research on support services for survivors of EVD, published in 2014 in the MMWR, which is Morbidity and Mortality Weekly Report. Having worked as a child protection consultant at the Ministry of Social Welfare, Gender and Children's Affairs in Sierra Leone, formerly supported by the UNICEF, she was also a former facilities coordinator, UNFPA, where she coordinated and helped with rehabilitations and construction of 8 health facilities. I can remember that, yeah, including the Rokupa and Kinaman Hospital. She was part of the COVID-19 consultant and quality improvement consultant, and currently working as reproductive health specialist and advisor at the Well Woman Clinic. She has a passion when it comes for anything women, but men, you can still consult, okay? Madam Davis has continued to show her passion for women's reproductive health in the field of breast and cervical cancers as she continues to raise awareness, advocate for quality services, raise funds, providing technical and clinical support to Sierra Leone Cancer Society and the Well Woman. She is a humanitarian who supports palliative care. So if you don't know palliative care, maybe we'll have time to talk about that, with free opiates and providing mothers with free mothers and baby packs to see them through the first weeks of delivery. Wow, the woman is loaded. um, I'm going to introduce her now to us, Madam Tina Davis. Thank you so much for being with us today. Please say hi to our viewers.
Good evening, viewers, and I'm grateful to be here this evening. Thanks for joining.
Thank you so much. Thank you so much, Madam Davis. Well, I can see your passion, and most of what I have read here about you, I can testify to that because I know how you campaign, and you have demonstrated excellence and professionalism in everything you've done. I've seen how you campaign so hard, even on Facebook, on social media, for Well Woman Project, and some of the projects,
Thank you.
especially you did in Sierra Leone. So I really want to commend you for that. I want to say well done for your work. So thank you so much, viewers, for joining us. Please do remember to share this, and I know many of you will get to watch it as we go along. So, Madam Tina, I reached out to you. Thank you so much for accepting the offer to come on. I know breast cancer, there are some things that's it's part of the reality of what we are going through, of what people are going through. Many people are going through it. You know, Sadly, people have lost their lives, but all hope is not lost. And I just felt that it will be good for us. I know Breast Cancer Awareness Month is coming, which is October. Uh, it will be acknowledged worldwide. I know that's coming on, but like you said before, it is never too late. It is never ever too late to talk about something. So I just want us to start today for the benefit for as many. Some of us women are already going through it. Maybe somebody after this show today, you might decide to go and give yourself a check. Go to the bathroom, go to the room, go to the toilet. Just check yourself. You might just be timely. This might be a timely point for some of us to go get ourselves checked up. So we are going to start without further ado. Madam Tina, we're just going to hit the nail, and please feel free. This is your area. Please feel free to vent out. I know this is your area. You want all women to be well as much as you can. So my first question I want to ask us today, I want to ask you today, what do you describe as breast cancer? What do you describe as
Um,
breast cancer?
Thank you, Florist. What I can describe as breast cancer is, as I asked you before, what's your audience like? Because we need to ensure that whatever discussions we're having here, it's actually having a good impact. People understanding what we're saying, and hopefully will bring about some kind of behavioral change. So breast cancer is when you have abnormal cells that grows rapidly in the breast, rapidly uncontrollable. So basically, if you have a box, a square box, and you have rectangular stuff going in, you know that it doesn't fit in well. So, in a nutshell, that's what breast cancer is. But I just want to hasten to say that not every breast change is breast cancer. Because some people, little breast change, they think they have breast cancer, they keep hiding, they don't go, especially when it comes to the ethnic minority group. These are things that we don't talk about because we think it's been stigmatized. Oh, well, what would people think? I have my family, I have my kids. But then most breast change, especially with younger women, these are just abnormal, benign breast changes. I just thought to raise that because not every breast change is breast cancer. So we can clarify that because most young women, most of the breast change will be like when they feel lumps and stuff, it could be fibroadenoma, which is just fibrous tissues. And based on their hormones, it comes and goes, grows faster, or it's something that they need to keep an eye on. But before we talk again about breast cancer, we talk about breast awareness. What does our breasts look like? Are they symmetrical? Forgive me, I'm florist because I'm very practical when I talk about breast and what I do. So you look at your breast, see if
Go
they're
ahead.
symmetrical. So you stand on the mirror, you can put hands akimbo, just have a look. Are the nipples in? If they're normally in, that's normal for you. Is one breast bigger than the other? If that's the case, it's normal for you. If, for instance, you've had a knock before and you have a bit of tissue you can feel, that has become part of your breast. And these are the reasons why when women are 47 or 50, invited, that's in the UK, invited for the first mammogram, you get recalled for assessment. Recalling for assessment doesn't mean you have breast cancer. Basically, it's just showing that the mammogram, that's the picture that they've taken, they've seen some abnormalities there. And these abnormalities may be normal for you. But until you get there, get assessed, do further mammograms, whether it's MCC, which is micro classification, you know, they have a look at these things. And at different angles, they might take biopsy, just ultrasound, or do an assessment, physical assessment, and they realize that no, it's nothing to worry about, and you get discharged for recall in another 3 years. So women in the UK actually are very blessed to have the NHS providing such services, which is well, you will say compulsory, but you'll be every woman is being invited to that. Some people have very strong family history of breast cancer. So with that, you can ask your GP, you can go in anytime. It doesn't necessarily mean you have to wait for the recall when you're 47 or every 3 years. So I'll stop here for now, Floris. Then I'll hand over to you.
Wow. Thank you. Thank you so much, Lady T. So somebody might be asking, what causes it? What are, or for what would I say? What are the signs, and what are the symptoms? I know you've talked about us examining ourselves, but what are some of the causes, or what are some of the signs and symptoms we should also look for? Because there might be visible and invisible signs and symptoms.
Right. In terms of signs and symptoms, mostly about breast cancer, first of all, what we need to know, as I firstly said, we need to be breast aware, know what's normal for us. But the signs and symptoms, as we said, if your breast is normally out, like the nipples already, standing, and you realize that an nipple has gone in, that's called inversion of nipples, then you need to get it out, because there might be something that's behind it, sucking that nipple inside. If you're what they call like orange peel, if you look at your nipple, if it was smooth and all of a sudden you realize that it's changing, it's getting harder, these are things you have to report. It's becoming painful and you're not on your menstrual cycle, because that's another thing that women misunderstand. If you're on your menstrual period, it's normal to have very tender breast. But if you're not, that is out of your cycle, it's over like a week or two out of your cycle, then you know that you're not ovulating, then you continue having persistent pain. It's something that you need to report. If you're having lumps in your breast, that's something. If your nipple is discharging and you're not breastfeeding at all, that's one thing. And the nipple, if it's sort of reddish discharge or yellowish discharge, this is something that you need to report. Because normally, if women are not breastfeeding, they shouldn't be. Although at times people do have hormonal imbalance that will make them have, discharge in their nipple. So I just want to clarify that if you're having that, doesn't mean it's a sign of breast cancer. It's just your hormonal levels. And with that one, you need to go to your gynecologist to get that sorted out. And, what we call lymph nodes, you feel underneath your arm and see, just feel that. If there's any lumpy bits that you have never discovered or realized, then this is something that you need to get checked out. When we talk about our breast, most people think it's just the spit. No, this is not just our breast. It's from the collarbone all the way here down the spit there. Because the lymph nodes all start here, the back of our ears. So we just need to be breast aware. And how do we examine ourselves? As I've mentioned, you examine yourself at least once a month. At least once a month. Because we don't want people getting all hypochondria thinking, every day, because nothing's going to change every day or even within a week. So once a month, you check yourself, mostly when you're in the shower, because you have soapy hands, then you can feel the smoothness there. And what you do, if you raise your hand up like that, you do the opposite breast. So it's easy to feel, all this bit here. And when people are taking like moisturizing, a lot of Black women moisturize their skin. So if you have your cocoa butter and stuff like that, they have smooth hands, then you can feel your breast as well. But first of all, stand up in front of the mirror, have a look to ensure that you actually familiarize yourself. It's like saying that we're having a relationship with our breasts. Because most people will just wear our bras, we don't look at it. And most women, probably their partners find out whilst they're, fondling around, they find out that, there's something wrong. Something looks harder on that side. So most of, women, their partners will detect abnormalities on their breast. But we need to take responsibility and ensure that we check our breast, we familiarize ourselves with our breast. Then we get to know what's normal for us and what's abnormal. Without knowing what's normal, we cannot detect what abnormalities we might have developed. I'll stop there for now.
Wow. So, Madam Tina is saying to us, checking is very important. And also, you said something, because I know for us women, when our emotions are all over the place, it's like the moment you feel something, you're panicking, because it's not a health challenge to be joked with, or for say to mess about with. But will you advise that, okay, if somebody is not sure, can they just go to their GP, and just for peace of mind? Because I remember there was a season in my life I was really having challenges in that area. I'll never forget, I went and they actually sent me for a mammogram. Since I'm not endowed there, it was so painful. It was so painful to go through that check. At the beginning, they said to me, "Oh, maybe there is a shadow. There is a this." I'm like, shadow, whatever. But they said we will continue to check and check. And by the grace of God, I'm here. This was how many years now up the line. But I think the point you're making, checking is very important. They can check, and if there is nothing, there is nothing. I think early intervention is important, and that's one of the things that we are advocating for now. What will you say about early intervention? Why do you think identifying and just notifying a professional about this is important? What's the link with that when it comes to early intervention?
Absolutely. They always say early detection saves lives in every disease, not just breast cancer, not just cancer in general. Because if you know what's normal for you and you think there's something abnormal, you go see your GP. And the fact that you have gone early means that if it gets diagnosed as something nasty, it'll hopefully be in an early stage. An early stage, for instance, with breast cancer, or any kind of cancer, what they will do, probably radiotherapy, surgery, chemotherapy, and they'll be successful in that. But then if you've waited or been hiding that there's all these changes going on, you don't want to say because you're scared of the worst. And most of the time, we know our bodies. If it's something very suspicious, our bodies tells us, and that's what creates the fear in us. But then I think the fear kills us, and not most of the time the disease. Because then if you decide to challenge disease, that okay, I think I have something nasty going on, let me go to the GP, you get a mammogram done and an ultrasound is being caught early, then you've done yourself a favor, because you end up having a treatment, going about your business, and where you probably would have just had an incision, like a wire guided incision, because you went in early and ended up having a mastectomy, then you see that, oh, I thank God that I came in early. And just to take a step back doesn't mean everyone having a mastectomy went in late. That's not the point. Because at times you have very aggressive cancer that, whether they do all wire guided or so, it wouldn't help. And again, it depends on the size of the breast. If you have a good size of breast, then they'll say, okay, we can do a surgery and remove that bit and a clear margin. But then if your breast is very tiny, even if they try to do that merging, there won't be much left at all, you see.
Hmm.
So at times we think, okay, well, having big breast or, voluptuous, you get backache and stuff, but then at times it does help with certain, diseases. And so our awareness is very important. Early detection, very important. And with this one, I'm going to skip a little bit from the breast cancer and talk to our brothers and fathers, because men are notorious. When it comes to health seeking behavior, it's one thing that the wives, the sisters, or the mothers, we have to drag them to the doctor,
Hmm.
especially prostate cancer. No man should die of prostate cancer. We do know that Afro-Caribbean men normally have a higher PSA than Caucasian. That's the prostate specific antigen. But if you notice that whilst you're passing urine, it's abnormal, then you just know something isn't right. If it's just an infection, then you go to the GP, it gets cleared out. But if it isn't, they get treated easily. That's one of the most easily treated cancers. But don't wait. Don't hide it. You suspect, go for confirmation. Don't keep it. And women, let's encourage our brothers although it's a very private thing, they may not speak to their sisters about it, but your partner, your husband, if you notice he's taking longer, going for a wee in the toilet, and you hear that drip, 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 as if a tap hasn't been locked properly, then something isn't right. Go check and encourage them to go and see a doctor, because they can easily, be treated and forget that they even had prostate cancer. So now let's come back to breast cancer. But I just thought that's one thing that, most of
Yeah.
our, you know, Afro-Caribbean brothers and fathers suffer from. And now, before it was like breast cancer as well, over 50s and all, but really young men in their 40s are getting prostate cancers now. There was a joke that is something in the water, like the pills that we take is what's contaminating the water. That's why a lot of men are having prostate. But that was just a joke. But these are the things that we have to be really conscious about when we need to go. There is nothing wrong in going to the doctor and they say, oh no, it's just false alarm, false alarm, nothing to worry about. It's safer that way than not going at all and it end up being something really nasty. So let's all be aware of our bodies, early detection, even with the blood pressure, having headaches persistently. You think something isn't right, go for a blood pressure check. And if you start having that medication early, or first of all, if it's a diet, they need to sort out, even with the diabetes, diet control, before it gets to, start taking diabetic medication or injections. So these are the things that early detection, whatever, be aware of your body. Whatever is abnormal that you suspect, please, we have a great opportunity here. Free health fair. Go to your doctor, tell them what it is, let them do investigations. And if it's something that is, it's come as a diagnosis that you've got either diabetes or hypertension or whatever it is, you are in the right place to get cured. At least they can manage all the symptoms.
Wow. You touched on something there. Thank you. I was just keeping an eye on the comments. Nurse Teresa said early intervention. They supported what you were saying. Early intervention, self-awareness and assessment of our breast is very, very essential. This is for every woman out there. Somebody said prevention is better than cure. You touched on something when it comes to us, this is practical. When it comes to us, especially us in the BAME community, cancer is one of the things that, the moment you hear that word, that's like a death penalty. And up to now is something that we are unable to handle. I've lost family members through cancer, so I know what it feels. I know many others have, but sometimes the way we handle it is slightly different to the way Caucasian people handle it. Times have changed. What can you say to us? Because when you think about it as a proper BAME woman, when they give you that diagnosis, you are like, oh God, you start thinking about everything. You start thinking about your children, your family. In fact, you've never started treatment or anything. Just in my language, they say brocat. We say that in pidgin. Just the pain, your heart is broken. If you're not careful, that kills you. Even if the plan of God for your life was like, okay, you will go through this, your years will be extended, whatever, but we've given up on hope already. Today we are here to say all is not lost. Please, if you notice something, even if they've given you the news, even before you start the treatment, please don't just allow this thing to just break you. There is hope. There is so much success rate these days. Lady T, what advice do you have? Because again, people talk, it's the stigma. That's why people can't even talk about it. People think about, sickness comes to everybody. God is not partial to say, oh, today this person is the one. Nobody is better than the other. Challenges, sickness is part of challenges of life that we go through. But when it comes to us, we have to find a way of dealing with it spiritually, physically, mentally, socially, emotionally. It's so important, lady. Madam T, what do you have to say to encourage our BAME brothers and sisters, wives, families? Because this is everybody. When the thing happens, it affects family. It affects everybody.
Um, First of all, I'd like to encourage you to say that because the family support, and especially in the Black minority communities, we are quite close. in the sense that you must have somebody you call your brother or your sister. Talk to somebody who can support you through it. Because these are the sort of things when people don't have support, they are scared. But even if you don't have family or friend support, there are services. The NHS got services, palliative, social welfare, whatever it is. Even people are going through like end of say care and they have children. How do you plan for your families? They help to do that for you. But the fact that I always say we are in a privileged society, we have opportunities. As much as we look at opportunities to develop ourselves out here, we have opportunities to have a better health care. Because whatever it is, as long as it's been diagnosed early, your prognosis will be much, much, much better. It's similar to even the COVID situation we have at the moment. The encouragement about the vaccination. When you get vaccinated, doesn't mean you cannot have COVID. But when you have COVID, your chances of survival and your chances of not being hospitalized are greater. So these are things that, let's just take all of these examples put together, different things around us. Let's just sort of connect them to see how things have worked for us better when it's been dealt with earlier than when we left it, later on. So please, we have an opportunity. Early detection saves life. Whatever that you think that you're concerned about with your health, don't be ashamed. Forget the stigma. I know our societies don't talk about certain things. If you can't talk to anybody, go to your practice. The health visitors are there, the nurses are there, your GP is there. They're there to support you. Unlike if you were, for instance, I'll take Sierra Leone as an example, wherein the healthcare system is not that, developed, especially cancer, the cancer services, which we've been trying really hard to ensure that at least, their services. That's why you see me going around getting opiates for palliative care patients and ensuring that it's being given to them for free because I did not pay for them. And I shipped them to Sierra Leone, and I expect that the palliative care patients should receive that free of charge. And that's why I actually go in and check the books to see how was it dispensed, who had it, and see who was on admission or whoever is at home. And luckily, there's a British doctor who is a palliative care, Dr. Mary Bond, who receives most of the donations that I give of opiates, and she ensured that they've been sort of administered judiciously and ensuring that the right people get it and nobody get charged for it. So
Wow.
we have.
I just wanted to ask a question.
Yes,
Madam
please.
Tina, I just wanted to ask a question. Somebody might be wondering, what's opiate? What's that? Is it a treatment?
Opiates, these are controlled drugs for pain management. We don't get them over the counter. Our GPs wouldn't just prescribe it for us. It's something that, it takes away the pain. But if you have asthma or other things, because they have the side effects of, respiratory oppressants or depressants. So these are things that they are controlled drugs. Even in hospitals, you have to be qualified and you need 2 people to sign for all of this. So, and these are stuff that I come out here and, I know people who know people from my last work and stuff like that. So I get them, and some pharmacies as well, which I normally send to Sierra Leone for the cancer ward or the palliative care department.
Okay, I thank you so much. And viewers, I hope we are really picking up something from this early intervention, awareness, checking ourselves. Very, very important. Madam Tina, you spoke about is it mastectomy?
Mastectomy, that's removal of the
Mastectomy.
breast.
What is that?
Mastectomy is when you have partial or complete, when basically they remove the breast. And this sort of surgery is very common in Africa. Initially, when I went back home in Sierra Leone, I noticed that most of the surgeries are mastectomy. And I'm thinking that because all the surgeons are men, they don't think about body image and stuff like that. They just have mastectomy, removing the women's breast. And so you can do surgery without that. But reality kicked in. I had a knock on the head saying, hello, be realistic. Because here we don't have, radiotherapy where you say the area is being, radiated to kill all the cells. So the best they can do is do a mastectomy to sort of avoid any recurrence or relapse or anything like that. So that's the reason why majority of them just do the mastectomy. But it was something that I was way against. I spoke to one of the top surgeons, a professor in the North Mead, who's a breast surgeon. I had discussions with the former Minister of Health, that's Dr. Alpha Wuri, because we had arranged to see how we can go to Sierra Leone. And actually, he wasn't charging for his services. It was just his flight and hotel, wherein he would do surgeries and get very good surgeons, observe him, and he can train them to do these surgeries to ensure that our women get, a good, get good results. When they stand in the mirror, they realize, okay, I had breast cancer, I had surgery, but it's not too bad. You see, so these are the sort of things that, a lot of other ethnic minorities around, that if they have the kind of connection or linkage, they can try and see how best they can support. And even with the prosthesis, that's like, people who wear padded bra, but these are, they got gel in them. It's, so this is something that we don't have there either. But when I come, due to my former jobs here, have good network and good relationship with my further works, I'll come, I get so many prostheses I send. Prosthesis in the sense, if you look, if I've had a mastectomy, for instance, obviously this other bit is flat, but the prosthesis, which is the jelly-like lump, fillet kind of thing, just it feels like a breast. So I'll get the right size. So if I'm 32B, I'll get 32B breast, which can come in here, makes it symmetrical. I'll go about my business. I can swim in it. Nobody knows I've had a mastectomy. So there are so many ways we can actually help to support women out there. But then if we don't know how to support ourselves, how are we going to support others? So we need to be aware, we know what the challenges are, then we'll be able to support other people. And a very, very sad one, Floris, I have to say, is that the disease is one thing that probably kills, but I wouldn't say the fault of the women, because it's a choice that they have to make. If a woman, a trader comes today, there's a problem with the breast. They've had ultrasound or mammogram, it shows that it's cancer. Now, this woman, this is something that I have experienced so many times. This woman comes and she's got 3 children, a single mother. Now you're asking me to go pay, say, about 2 million, for instance, Sierra Leone money for the surgery. You need tamoxifen, you need different kind of medication. That woman will say to you that, you know what, I'd rather die. Well, I can't spend that money on just me and leave my kids suffering, because we don't have social services there. So most women will opt to look after their kids, to feed their families, as opposed to, having treatment. But that's where some of us come in as well, because we've raised funds, like through the World Women Clinic, we raise funds to support such women, whom we know that if we don't do anything, they have no other sense of income. We can support them go through their surgery, and we have some connection with some pharmaceutical companies, like for Len Godi Harris, who is one of the best radiologists, how they can get like reduced mammogram and stuff like that through, he reads them, but through Troyton Hospital. So the networking, most of the time, it's not just cash. It's about relationship, how you build, collaboration. And as long as that collaboration is being well coordinated, yes, you end up needing money, but not as much that you'll need. And these are the sort of support that are priceless, because you can support so many people. Come October, you will see Troy Trump will negotiate with us. We'll say, okay, he will say, okay, the first 10 women that are going to come for screening is going to be free. They will do that. And maybe another 50% for the rest of them that will be coming in. And most of these will ensure that the women who are less privileged, the low economic women, actually benefit from all these discounts, as opposed to getting the first 10, and these are women who can afford. It means we are depriving those who can't. And really, most of these, the awareness is for everybody, but the fundraising and support are for such women, and they are in the majority in Sierra Leone. I'm sure in most other African countries, that's a similar situation they have there.
Situation.
So women die because they want to support their families and they can't be bothered about themselves. So reasons say that we are in a privileged society. We have an opportunity. Let's make good use of it. Because people out there, a lot of things that people are not meant to be dying of, they die off because they don't have the services. But
Yeah.
if we have the services here, let's encourage each other to go forward and accept, because you get invited for breast screening. You have to accept it. If you DNA a few times, they take you off. So we need to accept the invitation, go and see what's, wrong with our breast. It could be nothing, as I said. Most women, like over 40% of women being recalled to assessment after a mammogram, is because they don't know what the normal breast looks like. That's the very first image they're having. So if there's any abnormality, they call you, they check, and then realize that it's normal. They get a history of you. When you go for screening, they don't get that history. When you get recalled, it's just a film that they send. They don't send any history with it. So the breast unit will have to call you to see exactly what's going on. And at times it's just a chit chat. But especially women who have the history of breast cancer. And that's where our Black ethnic minority comes in again. Because most of the time, our grandmothers die, our mothers die, their aunties die. We don't know what killed them. They've just been sick, or they had a little boil, a little lump in their breast. We don't know whether it's breast cancer. So it's very difficult for us to know whether we have a very strong family history of breast cancer. Because if you have that, you can easily say to your GP that even in your 20s, you can go, you have a mammogram done. Because if you're concerned, you can have an ultrasound on whatever it is, because they know they have a family history of that. So please, if anyone have died in your family that you're not sure, all you heard is that, oh, they are breast, but it's happened within the family, a few other people, go to your GP. Tell them you suspect that that's what. Yes, you didn't have any confirmed diagnosis, but you suspect. And based on your strong suspicion, they can do mammogram or ultrasound for you, just to ensure that you have that peace of mind. So early detection does absolutely save lives.
Thank you. Thank you so much. I'm going to reiterate again. My people suffer because of lack of knowledge. And now I'm going to add my own, not only because of that, because of fear, because of intimidation, because of stigma.
Absolutely.
Women, sisters, aunties, you are not alone. You are not alone. And I just want to use this opportunity to salute every woman that has fought this battle. I personally know a lot that has come through. I have prayed with a lot. I'm a person of faith. So I believe in everything holistic. I as much as somebody's faith can take them, I believe the Lord has given the doctors the wisdom as well to do something. So whatever route you want to take, Madam Tina, I know I'm looking at my time, but let's see if we can chip this
Don't
in a bit.
worry, that's fine.
Because of fear and panic, yeah, sometimes some people don't want to go for some of the treatments. So, for example, the chemotherapy, I know you're not here to give us what is the best. I'm not saying that, but what are the different types? I know, for example, you see some of those things, yeah, we don't have a clue until one day somebody get this experience. My brothers and sisters, let us read. I lost my husband through cancer. I've lost my mother through cancer. Before then, I don't read about none of those things. I just walk past as if it's not my business. We are not reading to say, oh, okay, because you read, you're going to have it. But it's just good so that when somebody else close to you, you are really you're not able to support somebody if you don't know about that particular, even if you don't have a clue about what they're going through. So what some of these treatments that are available, and also, why people are going through those treatments. I know you've talked about coping mechanisms, how it's important to have a good support network. If you don't want to relate to the people of your kind, relate to the professionals. So how can we encourage many people about the treatments? Because some people are scared that the treatments are harsh, this, and some people go for holistic treatments, different kind of things. What do you have to say towards that? What's your take on that?
Well, florist, it's just the normal, when you say what's normal. But initially, first of all, because it's a process, it's a cycle, and it's, the clock ticks so fast. Here, like within 12 weeks of diagnosis, or probably it's probably reduced, you mean to have your first treatment. So, diagnosis, then you go in and see whether it's surgery that you need, if it's chemotherapy and radiotherapy, depending on the
I'm just laughing here. Somebody's comments said that's foolishness.
Oh,
But because there are people
depending on
who will die.
how how drastic or how rough the cancer is, because some of them can be really, really painful. So you have a small cancer, and probably just radiotherapy will deal with that. Others, you need a combination of surgery, radiotherapy, and probably chemotherapy. But some women as well will have reconstruction if they've had a breast surgery. So there are lots of things, ways. And I know for us, because of the stigma in our societies, most women, the first thing, breast cancer, the first thing they think about, death. Secondly, they're going to lose their breast. But if you have to lose a breast and you have a family, for me, if you ask me, I'd rather have one breast or no breast and be there for my family and stay alive than have both breasts and 6 feet under. So these are choices that we have to make. I used to run a survival clinic as well, interestingly. We have those who've had mastectomies, basically reassuring, because a pair, mind you, they always say, who feels it knows it. They have gone through that. So they'll support all the women who are newly diagnosed, who are going through treatment to see how, say, this is how I did it, this is how I went through it. There is a lady from Fullerton who doesn't want to be identified, but she comes to the clinic and she will support all the women, but she don't want to be on camera because of the stigma of her society. How they will look on her as having, had one breast removed, which is mastectomy. But guess what? Her partner, her husband, is so supportive. She said when she used to go to the bathroom, she will hide. She will stay in there. She doesn't want him to see her naked. Obviously, by that, that their sexual, life is gone down the drain, because she will never take off her clothes and stuff like that. But he said to her, listen, I know you have one breast. I know, but I love you the way you are. You could have had both breasts and died, and I won't still have you here. But the fact that you're here, you've had your surgery, stop being ashamed. I know, and it doesn't matter to me. And I pray that we have such husbands to talk to their wives or their partners like that, to say it is okay to have one breast. There's absolutely nothing wrong with that. Because, you are alive and I get to spend more time with you. Tomorrow is not promised any of us. I could be sitting here today, I'm gone tomorrow. Look at the number of people that have died with this COVID. So if there's anything we can do to sustain our lives, gives us an opportunity and not a chance, I'm pleading, my brothers and sisters, please take the chance. Take the opportunity.
Wow.
There are lots of people out there who don't have such opportunities. We are lucky to be around here, and we are lucky to have such services. So please, it's on a golden platter for us. Let's take it. Let's run with it.
Thank you so much. Thank you so much. Well done to supportive husbands. Well done to supportive family members. And you know what? In my PG language, it says the rain does not fall at the door of one person. Nobody knows what kind of rain is going to fall at their door. So this thing about stigma and gossip and something, when somebody has a health challenge, we need to stop it. We need to stop it. Please, we are encouraging everybody. Please, let's be mindful. Let's be sensitive, and husbands. My husband was going through his challenge, I physically went through it with him, psychologically, so it affects partners as well. And for partners whose wives and their partners are going through such, please, if you can seek support, because you're suffering physically, mentally, spiritually. Please seek support. Don't be ashamed. Seek from the professional if you don't want to talk to anybody that you know. Since some of us, we are really struggling when it comes to these things, but seek support as much as you can. Mr. Abasi Conte had a question: what are the chances of inheriting breast cancer?
Well, as I mentioned before, the chances are you need to know your family history. Family history in the sense that if a few people or few women, whether it's aunties, grandmothers from either sides and stuff, that you suspect they've had breast cancer, this is something you need to get checked out. I have seen people who've got very strong family history of breast cancer. They go into the clinic, that's in North London Breast Screening here, Edgware. They have their mammograms and you tell them that, oh no, it's not cancer. They cry. It's so difficult to cancel such people because what they're expecting is it's cancer, because that's been the norm in their family. And when you say to them, no, this is not cancer, it's fine, you will think they've just been diagnosed as having breast cancer. They will cry. It's like, and these are tears of joy. And they're thinking that this is unbelievable because, as far as they're concerned, it's their turn. That is the norm in the family. So, breast cancer in families, it's very strong when you have a couple of women having breast cancers in family, whether it's a great grand aunt or aunt. These are things that we need to know our family history. I know we don't get to know what kills who and all of that, but it's very important that if we have close families, we talk to each other what the diagnoses were, especially if, tell Mr. Abase, or he can hear me, prostate cancer, it's similarly. Men don't talk about things, but if you notice your dad or granddad was, dripping, blood, or taking a lot of time in, the loo, just know, suspect something isn't right. And talking of prostate cancer, my dad had prostate cancer before he passed when he was here, but he did not die of prostate cancer. He had all the treatment. So he was fine. But I was there to support him through it. We go to the doctors together, we go to the physician together. Well, because I was in the field, so it was a lot easier for me to just go in there. And there was a day that the professor said to my dad, Mr. Gebe, I think we're going to do a difficult thing. Because my dad was thinking of going to Sierra Leone. We need to give you some injection. But this injection would cause impotency. And I look at the professor and I'm thinking, what are you talking about? I know it's his job to look at a patient holistically, their sexual life and everything. I'm like, look at my dad. He's almost 80. You're talking about him having sex? I'm his youngest. Please just stick the needle in there. I need him alive. His sexual life is not, So we all just laughed about it. My dad laughed as well. But because I was in that kind of thing, because I said, no, it's not a matter of choice. He doesn't need to make a choice about that. He needs to leave. And he had all his treatment and he was grateful. And when he wrote his biography and stuff like that, he wrote some bits of that as well in it to say when he was going through his treatment. You will see your partners. And that's where, again, we support men. Because your man will be probably incontinent because he's not, emptying his bladder well because the arteries have narrowed and stuff. So the wee doesn't come easily. And if they have to use sanitary pads and stuff like that, we all need this support. That's the only way they can come out, because the psychological torture is worse than the disease itself. But when you have somebody to relieve that pressure, that burden, professionals do support. They are good. They're only doing their job. But when you have family or that close person with you, it makes the difference. But if we don't say, the person wouldn't know. How would they support you if they don't know?
Wow.
Then again, let's be attentive to our children or our partners. Because when you're attentive, if your guy's been going to the loo like 2 minutes, he's out, and he's starting to stay there another 5-10 minutes, he's not on the phone or doing anything, and you're thinking that, when he comes, they go, oh, honey, what happened? I noticed he will say, oh, no, it's nothing. No, amen. He will always deny it. But keep an eye on it. And even when, just the way men, whilst you're fondling, they feel the breast of women and think, oh, there is a lump there. And it wasn't there before. What's going on? Because traditionally, only the men can feel our breasts in a way, because we don't touch our breasts. We just make sure it's clean, we take a shower. But whilst you're making love, people touch your breasts and stuff like that. Similarly, if you have that kind of relationship with your partner, and this is adult discussion, you feel the testicles, you will know. There's just meant to be 2 lumps there. It's normally smooth, but it's getting lumpy, something else. Say to him that I feel something there. It's not normal because I hadn't felt it before. And this is quite normal with people who've lived together for a while. Then you say to him, no, let's go to the doctors. Something isn't right. That guy will tell you, I have to work. They'll give you every excuse under the sun. Make time and take him to the doctors.
Yeah. Anyway, I think we need to come back and deal with our men and our brothers, our time. It's amazing how, because everything is linked. So, there is no way we can deal with one another. But we need to come back. Madam Tina, please. I know you're busy, but I do hope you will give us time.
I will make time.
For another section, because we still need to deal with reproductive health. you know, yeah, we need to deal with menopause. We need to deal with, because a lot of us, so those topics are for another week. But I really want to thank you, viewers. Please share this video to be a blessing to somebody. This might be somebody's deliverance today. You know, back it up. Whatever you can do, back it up. Seek support. Above all, pray, because faith without works is dead. We are believing God for our healing. There are some physical things we need to do. So you're going through the treatment, watch your diet, exercise. Don't hide yourself in the corner. Please do not isolate yourself. Madam Tina, please, our viewers have really appreciated you today. Apparently very helpful information. Everybody's saying well done. So please, thank you so very much for your time today, and happy birthday. I know you just celebrated your birthday not long ago, and well done for the job you do. Thank you for the lives that you have touched, especially in Sierra Leone. And I pray that you continue to impact the lives as you seek the wellness of women. You yourself will remain well in Jesus' name. Amen.
Amen. Amen.
Thank you so much. I really do appreciate you, and God bless you. Thank you for joining us today,
Thank
viewers. I think she is worth appreciating. So thank you very much, and we hope to come back and deal with another aspect with our health. Thank you so much. Well, thank you so
you.
much, viewers. Remember to join us, viewers. Please do remember to join us. Hopefully, we're going to be again on the next program. Please remember to like and subscribe to the YouTube channel so that it can become even more better. Thank you so much for joining us today. We really do appreciate you. Spread the news, encourage your sisters, encourage your aunties, encourage your wives, encourage your nieces. You might have an older niece. So this is so important for all of us. And we will cut down a lot on these early intervention is what we are talking about today. Three major things: early intervention, self-awareness, self-check. Very important. And we will beat this, and we continue to pray that the researchers, the Lord will enable these researchers, the Lord will bless the researchers with more wisdom to be able, so that the success rate of survival will continue to increase by the special grace of God. Thank you so much, Lady Tina. God bless you, and
God bless you.
have a blessed week. Thank
Thank
you
you.
so much, viewers. We really do appreciate you. Thank you. Bye bye.